A 45-year-old man presents with a painless mass in his right testicle. Which of the following is the most likely diagnosis? A. Epididymitis. B. Testicular torsion. C. Hydrocele. D. Testicular cancer. E. Varicocele. Answer: D. Testicular cancer. A painless testicular mass is highly suggestive of testicular cancer, which is the most common malignancy in men aged 15 to 35. A 30-year-old woman presents with sudden onset of right upper quadrant pain, fever, and jaundice. Which of the following is the most likely diagnosis? A. Acute pancreatitis. B. Cholecystitis. C. Hepatitis. D. Choledocholithiasis. E. Pyelonephritis. Answer: D. Choledocholithiasis. The combination of right upper quadrant pain, fever, and jaundice is characteristic of choledocholithiasis, which involves the presence of gallstones in the common bile duct. A 55-year-old man with a history of hypertension presents with a severe headache and blurred vision. His blood pressure is 210 per 120 millimeters of mercury. Fundoscopic examination reveals papilledema. Which of the following is the most likely diagnosis? A. Hypertensive urgency. B. Hypertensive emergency. C. Migraine headache. D. Acute glaucoma. E. Cluster headache. Answer: B. Hypertensive emergency. Hypertensive emergency is defined by severely elevated blood pressure with evidence of end organ damage, such as papilledema, indicating a need for immediate medical intervention. A 60-year-old woman presents with difficulty swallowing both solids and liquids and unintentional weight loss. Barium swallow shows a bird beak appearance. Which of the following is the most likely diagnosis? A. Achalasia. B. Esophageal stricture. C. Esophageal cancer. D. Gastroesophageal reflux disease, GERD. E. Zenker's diverticulum. Answer: A. Achalasia. Achalasia is characterized by the inability of the lower esophageal sphincter to relax, leading to dysphagia for both solids and liquids and a bird beak appearance on barium swallow. A 28-year-old woman presents with fever, sore throat, and cervical lymphadenopathy. Physical examination reveals splenomegaly. Which of the following is the most likely diagnosis? A. Strep throat. B. Infectious mononucleosis. C. Acute lymphocytic leukemia. D. Cytomegalovirus infection. E. Toxoplasmosis. Answer: B. Infectious mononucleosis. Infectious mononucleosis, caused by the Epstein-Barr virus, typically presents with fever, sore throat, cervical lymphadenopathy, and splenomegaly. A 70-year-old man presents with bradykinesia, resting tremor, and rigidity. Which of the following is the most likely diagnosis? A. Alzheimer's disease. B. Amyotrophic lateral sclerosis, ALS. C. Parkinson's disease. D. Multiple sclerosis. E. Huntington's disease. Answer: C. Parkinson's disease. Parkinson's disease is characterized by bradykinesia, resting tremor, and rigidity, resulting from the loss of dopaminergic neurons in the substantia nigra. A 50-year-old woman presents with a painless, progressive loss of vision in her right eye. Fundoscopy reveals optic disc cupping. Which of the following is the most likely diagnosis? A. Macular degeneration. B. Diabetic retinopathy. C. Retinal detachment. D. Open-angle glaucoma. E. Cataracts. Answer: D. Open-angle glaucoma. Open-angle glaucoma is characterized by painless, progressive vision loss and optic disc cupping due to increased intraocular pressure. A 25-year-old man presents with painful urination and purulent urethral discharge. Which of the following is the most likely causative organism? A. Chlamydia trachomatis. B. Neisseria gonorrhoeae. C. Treponema pallidum. D. Herpes simplex virus. E. Trichomonas vaginalis. Answer B. Neisseria gonorrhoeae. Neisseria gonorrhoeae is a common cause of urethritis in men, characterized by painful urination and purulent discharge. A 60-year-old man presents with progressive weakness, muscle atrophy, and fasciculations. Which of the following is the most likely diagnosis? A. Myasthenia gravis. B. Multiple sclerosis. C. Guillain-Barré syndrome. D. Amyotrophic lateral sclerosis, ALS. E. Lambert-Eaton myasthenic syndrome. Answer D. Amyotrophic lateral sclerosis, ALS. ALS is characterized by progressive weakness, muscle atrophy, and fasciculations due to the degeneration of motor neurons. A 45-year-old woman presents with chronic diarrhea, abdominal pain, and weight loss. Colonoscopy reveals transmural inflammation and skip lesions. Which of the following is the most likely diagnosis? A. Ulcerative colitis. B. Crohn's disease. C. Irritable bowel syndrome. D. Celiac disease. E. Diverticulitis. Answer B. Crohn's disease. Crohn's disease is characterized by chronic diarrhea, abdominal pain, weight loss, and transmural inflammation with skip lesions on colonoscopy. A 30-year-old man presents with a painful swollen right knee and a history of recent sexual activity. Which of the following is the most likely diagnosis? A. Rheumatoid arthritis. B. Osteoarthritis. C. Septic arthritis. D. Gout. E. Reactive arthritis. Answer E. Reactive arthritis. Reactive arthritis often presents with joint pain and swelling following a bacterial infection, commonly from a sexually transmitted infection. A 65-year-old woman presents with progressive shortness of breath and a dry cough. Chest X-ray reveals bilateral interstitial infiltrates. Which of the following is the most likely diagnosis? A. Chronic obstructive pulmonary disease, COPD. B. Pneumonia. C. Pulmonary fibrosis. D. Congestive heart failure. E. Pulmonary embolism. Answer C. Pulmonary fibrosis. Pulmonary fibrosis presents with progressive shortness of breath, dry cough, and bilateral interstitial infiltrates on chest X-ray. A 50-year-old man presents with persistent cough, night sweats, and weight loss. A chest X-ray shows a cavitary lesion in the upper lobe of the right lung. Which of the following is the most likely diagnosis? A. Lung abscess. B. Tuberculosis. C. Bronchiectasis. D. Lung cancer. E. Pneumonia. Answer B. Tuberculosis. Tuberculosis typically presents with cough, night sweats, weight loss, and cavitary lesions in the upper lobes on chest X-ray. A 35-year-old woman presents with a history of multiple spontaneous abortions. Laboratory tests reveal positive anti-cardiolipin antibodies. Which of the following is the most likely diagnosis? A. Systemic lupus erythematosus, SLE. B. Antiphospholipid syndrome. C. Factor V Leiden mutation. D. Protein S deficiency. E. Thrombocytopenia. Answer B. Antiphospholipid syndrome. Antiphospholipid syndrome is characterized by recurrent spontaneous abortions and the presence of antiphospholipid antibodies, such as anticardiolipin antibodies. A 70-year-old man presents with difficulty urinating, weak stream, and nocturia. Digital rectal examination reveals a smooth, enlarged prostate. Which of the following is the most likely diagnosis? A. Prostate cancer. B. Benign prostatic hyperplasia, BPH. C. Chronic prostatitis. D. Bladder cancer. E. Urethral stricture. Answer B. Benign prostatic hyperplasia, BPH. BPH is characterized by difficulty urinating, weak stream, and nocturia with a smooth, enlarged prostate on digital rectal examination. A 45-year-old man presents with severe chest pain radiating to his back. He has a history of hypertension. Which of the following is the most likely diagnosis? A. Myocardial infarction. B. Aortic dissection. C. Pulmonary embolism. D. Esophageal rupture. E. Pericarditis. Answer B. Aortic dissection. Aortic dissection typically presents with severe chest pain radiating to the back in a patient with a history of hypertension. A 50-year-old woman presents with fatigue, pallor, and a craving for ice. Laboratory tests reveal a microcytic, hypochromic anemia. Which of the following is the most likely diagnosis? A. Vitamin B12 deficiency. B. Folate deficiency. C. Iron deficiency anemia. D. Thalassemia. E. Anemia of chronic disease. Answer C. Iron deficiency anemia. Iron deficiency anemia presents with fatigue, pallor, a craving for ice, pica, and a microcytic, hypochromic anemia on laboratory tests. A 60-year-old man presents with fever, weight loss, and night sweats. Physical examination reveals painless lymphadenopathy. Which of the following is the most likely diagnosis? A. Hodgkin lymphoma. B. Non-Hodgkin lymphoma. C. Chronic lymphocytic leukemia, CLL. D. Acute lymphoblastic leukemia, ALL. E. Multiple myeloma. Answer B. Non-Hodgkin lymphoma. Non-Hodgkin lymphoma often presents with fever, weight loss, night sweats, and painless lymphadenopathy. A 35-year-old woman presents with recurrent episodes of severe, unilateral, pulsating headaches associated with nausea and photophobia. Which of the following is the most likely diagnosis? A. Tension headache. B. Cluster headache. C. Migraine headache. D. Sinus headache. E. Trigeminal neuralgia. Answer C. Migraine headache. Migraine headaches are characterized by severe, unilateral, pulsating pain associated with nausea and photophobia. A 40-year-old man presents with a chronic productive cough, wheezing, and recurrent respiratory infections. Chest X-ray shows tram track opacities. Which of the following is the most likely diagnosis? A. Chronic obstructive pulmonary disease, COPD. B. Bronchiectasis. C. Asthma. D. Pulmonary fibrosis. E. Cystic fibrosis. Answer B. Bronchiectasis. Bronchiectasis is characterized by a chronic productive cough, wheezing, recurrent respiratory infections, and tram track opacities on chest X-ray. A 50-year-old woman presents with difficulty climbing stairs and rising from a chair. Physical examination reveals proximal muscle weakness and a heliotrope rash on her eyelids. Which of the following is the most likely diagnosis? A. Polymyositis. B. Dermatomyositis. C. Myasthenia gravis. D. Lambert-Eaton myasthenic syndrome. E. Multiple sclerosis. Answer B. Dermatomyositis. Dermatomyositis presents with proximal muscle weakness and characteristic skin findings such as a heliotrope rash on the eyelids. A 60-year-old man presents with severe pain, redness, and swelling in his right great toe. Which of the following is the most likely diagnosis? A. Septic arthritis. B. Osteoarthritis. C. Rheumatoid arthritis. D. Gout. E. Pseudogout. Answer: D. Gout. Gout typically presents with severe pain, redness, and swelling in the first metatarsophalangeal joint, great toe, often triggered by hyperuricemia. A 25-year-old woman presents with abdominal pain, bloating, and alternating diarrhea and constipation. Which of the following is the most likely diagnosis? A. Irritable bowel syndrome, IBS. B. Crohn's disease. C. Ulcerative colitis. D. Celiac disease. E. Lactose intolerance. Answer: A. Irritable bowel syndrome, IBS. IBS presents with abdominal pain, bloating, and alternating diarrhea and constipation without any structural or biochemical abnormalities. A 70-year-old man presents with difficulty walking, a wide-based gait, and urinary incontinence. Brain imaging shows enlarged ventricles. Which of the following is the most likely diagnosis? A. Alzheimer's disease. B. Parkinson's disease. C. Normal pressure hydrocephalus. D. Multiple sclerosis. E. Amyotrophic lateral sclerosis, ALS. Answer: C. Normal pressure hydrocephalus. Normal pressure hydrocephalus presents with the triad of gait disturbance, urinary incontinence, and cognitive impairment, along with enlarged ventricles on brain imaging. A 55-year-old woman presents with a painless, enlarging mass in her neck. Thyroid function tests are normal. Ultrasound reveals a hypoechoic solid nodule. Which of the following is the most likely diagnosis? A. Graves' disease. B. Hashimoto's thyroiditis. C. Thyroid adenoma. D. Thyroid cancer. E. Multinodular goiter. Answer: D. Thyroid cancer. A painless, enlarging neck mass with a hypoechoic solid nodule on ultrasound is suspicious for thyroid cancer. A 40-year-old woman presents with bilateral, symmetric joint pain and morning stiffness lasting more than an hour. Laboratory tests reveal positive rheumatoid factor and anti-CCP antibodies. Which of the following is the most likely diagnosis? A. Osteoarthritis. B. Rheumatoid arthritis. C. Psoriatic arthritis. D. Systemic lupus erythematosus, SLE. E. Gout. Answer: B. Rheumatoid arthritis. Rheumatoid arthritis is characterized by bilateral, symmetric joint pain, prolonged morning stiffness, and positive rheumatoid factor and anti-CCP antibodies. A 30-year-old man presents with jaundice, dark urine, and generalized pruritus. Laboratory tests reveal elevated bilirubin and alkaline phosphatase levels. Which of the following is the most likely diagnosis? A. Hepatitis. B. Cirrhosis. C. Primary biliary cholangitis. D. Cholecystitis. E. Hemochromatosis. Answer: C. Primary biliary cholangitis. Primary biliary cholangitis is characterized by jaundice, dark urine, pruritus, and elevated bilirubin and alkaline phosphatase levels. A 25-year-old man presents with severe chest pain that is worse when lying down and relieved by sitting up and leaning forward. Auscultation reveals a pericardial friction rub. Which of the following is the most likely diagnosis? A. Myocardial infarction. B. Pulmonary embolism. C. Pericarditis. D. Aortic dissection. E. Gastroesophageal reflux disease, GERD. Answer: C. Pericarditis. Pericarditis presents with chest pain that is worse when lying down and relieved by sitting up and leaning forward, and a pericardial friction rub on auscultation. A 65-year-old woman presents with confusion, fever, and a headache. Lumbar puncture reveals elevated opening pressure, elevated protein, decreased glucose, and pleocytosis. Which of the following is the most likely diagnosis? A. Viral meningitis. B. Bacterial meningitis. C. Fungal meningitis. D. Tuberculous meningitis. E. Encephalitis. Answer B. Bacterial meningitis. Bacterial meningitis typically presents with confusion, fever, headache, and lumbar puncture findings of elevated opening pressure, elevated protein, decreased glucose, and pleocytosis. A 50-year-old woman presents with muscle pain, stiffness, and weakness, especially in the morning. Laboratory tests reveal an elevated erythrocyte sedimentation rate (ESR) and creatine kinase (CK) levels. Which of the following is the most likely diagnosis? A. Rheumatoid arthritis. B. Fibromyalgia. C. Polymyalgia rheumatica. D. Polymyositis. E. Systemic lupus erythematosus, SLE. Answer D. Polymyositis. Polymyositis presents with muscle pain, stiffness, and weakness, elevated ESR, and elevated CK levels, indicating muscle inflammation.